Welcome. This is the physical therapy portion of the pre-op class for total hip patients prior to surgery. I'm Chris Lee. I'm from Sport Physical Therapy. We have proudly been a part of Tri-States Care for about 35 years now. And we're going to be following you after you receive your new joint. And so what I'm going to do today is we're going to go over some items related to physical therapy and kind of touch on the important points for you and get you thinking about some things. So what we're going to cover is, first of all, we're going to go through home safety, okay? Then we're going to briefly review just a couple of exercises that I'm going to maybe have you start to work on prior to surgery. Then I'm going to talk about what is actually going to happen from a hospital therapy standpoint. And then lastly, plans for discharge, okay? So home safety, and you're probably going, why is he going over home safety? Well, what we want is, as you go home from your surgery, we want you to be able to get around your house safely. The last thing we want you doing is falling, okay? So what we're going to walk you through is kind of just home safety. So from the time that you get to your house and you start to walk through the door, what we want you to be thinking about is safety, okay? So as you start to walk through the door, you've got to be thinking about, okay, are there things on the floor like shoes or papers or power cords or other things like that? We want you to be thinking about safety. So we want those areas free of clutter, okay? So, and then as you start to go down the hallway, okay, or if you're in main living areas like your kitchen or your living room, we want you to be able to access those areas with a walker. You're not going to be putting your full weight on this leg after surgery in the most part. So you're going to be using a walker to help you, and we want you to be able to access all of those areas. So if you need to reconfigure furniture or other things to do that, we want you to be able to do that and not think, oh, I wish we would have done that in advance. So then lastly, going into your bedroom and your bathroom, again, thinking about those things is do we have enough free space that is clear of clutter? We're not going to be running into things. We're not going to have to sidestep through things. So trying to just think from a safety standpoint, the last thing we want you doing is falling. Now, what I would like to do is just briefly demonstrate a couple of the exercises that we're going to have you start from a physical therapy standpoint. So I'm going to kind of use this little bed here. And so typically what we're going to have you do is we're going to have you laying on your back, but I want you to just kind of squeeze your bottom together, okay? Most people at the same time while they squeeze their bottom together, they're also going to be tightening up their thighs. Okay, so if you squeeze and you tighten up your thighs, you pull your toes back so everything gets nice and straight, you hold that for 8 to 10 seconds, and then you relax. And then you repeat that, okay? So that's the first one. The next one is just to slide your heel up towards your bottom until you get into a good stretch. You're going to hold that for about 8 to 10 seconds, let it stretch, and then you're going to slowly come back down, okay? I know for some of you, that might be a fairly painful motion, so I'm not saying create additional pain. That's not what I'm saying. I want you to work in your tolerance, okay? Then we're going to have you slide your leg out to the side as far as you feel like you can comfortably go. I don't want to play Superman, or we're not trying to make snow angels. And then slide it back. But again, this is on your bed. I don't want you getting on and off the floor to do this. You maybe could do it on a couch, okay? But that typically is kind of, if you can work on those basic exercises, that will kind of get things going for us, okay? So now, let's shift gears a little bit and let's talk about what you're going to receive from us as you are in the hospital and post-surgically, okay? So again, what we're going to start to do is we're going to come into your room, okay, and we're going to be working on bed or seated exercises, okay. We're obviously going to work on walking. Post-surgically, walking is going to be a challenge for the first several days to kind of get used. So we're going to kind of go through the mechanics of how to do that, use your walker, maintain your balance, and be kind of assessing how all of that is be putting together. We're going to talk about how to get in and out of bed, get up and down from chairs, because we want those things to be safe. We want to be following the surgeon's precautions as we're going through these activities, okay? So that includes low chairs or surfaces. Sometimes the commodes at your home are pretty low. So we need to be thinking about those things as you have these surgeries, okay? So the other thing that we'll go over for those of you who have stairs going into the house, we want to make sure that we have those mechanics down. And so we're going to kind of go through that. The last thing that we want to go over with you briefly is talking about car transfers and how to safely get in and out of your car. We all have different kinds of vehicles. Some are really high, some are really low, some have plenty of space to get in. So we're going to just give you some quick pointers on how you can adapt that and make that work for you and make it safe. And then lastly, making sure the exercises that I've just briefly gone over with you are just kind of the tip of the iceberg. What we go over with you in the hospital are just basic foundational exercises. Down the road, we do recommend additional exercise. Now, on the day of surgery, okay, what's going to happen is you'll come back to your room. They're going to kind of let you recover for a little bit. And depending on when you get back from surgery, so some of you are going to have early morning surgery and you're going to be awake and alert and oriented by mid-afternoon, okay? So we may come between 3 and 5 in the afternoon. If it's after 5 p.m., it's likely going to be the nurse who kind of does some of these things. We're also going to kind of take a look at your pain. So depending on how bad your pain is, depending on whether or not you're dizzy or lightheaded, okay, we're going to put all of that together. And if those things are okay, then we're going to try and do some bed exercises with you, okay? See how things are functioning, get you going through the basic movements. And then we're going to try and get up. We at least want to try and stand. But for some of you, we actually may do some walking either in the room or out of the room or both. It depends on kind of how things go. Again, we're trying to be as safe as we possibly can be. We know you've just had surgery, and sometimes that can be a scary thing, but it's important. And then we're going to go over your home program, which is going to be extended. So we're going to give you a handout. It's going to have pictures and descriptions of everything that we want you to review and understand. We're going to go over car transfers, okay, and stairs. So the reason that we get you moving so quickly is because we're finding in the research and with patients that if we can get you up and moving day of surgery, people actually are going to functionally do better, and they usually go home faster. There used to be back in the day when I started therapy where we didn't really do much for a couple of days, but we have found that the anesthesia is better, the surgical techniques are better, and we can actually get you moving better, and you will have better outcomes, okay? So for those of you who are going to spend the night, okay, we're going to come in early the next morning, okay, and we're going to do treatment. So we're going to go through the bed exercises again. Repetition is the master teacher here, okay? We're going to walk 1 to 3 times a day with you, okay? If we're not going to be walking with you, we want you walking with either a CNA or a nurse. We want you with somebody for safety's sake, okay? We recommend icing for the first 1 to 2 weeks post-operatively. And then make sure, we definitely, if you're going to get in and out of bed, in and out of chairs, off the commode, things like that, we got to be using those call lights, okay? We got to make sure that we're safe. You're going to have anesthesia still working out of your system, so it doesn't work out in a matter of just a few hours. It can take up to 2 weeks to get out of your system. So we want to make sure that we're safe as we're doing these activities. Now, as we come in and we start to work with you, we may catch you when your pain is about a 4 or 5 out of 10 on a 0 to 10 scale. Some people are a little hesitant to do the exercises at that point, but what we realize is that if we can actually stretch you and get things moving, most patients actually feel a little better after we do that. So sitting and letting things just kind of stove up is not usually the best approach to this. So our goal and the hospital's goal is to make sure that we're trying to get you up and at least bedside, but preferably to try and get you in your chair sitting for all of your meals. If you're sitting and you're up, you're going to digest better, you're going to breathe better, it's going to be easier to eat versus eating in bed. So make that a goal right now, okay? So for those of you who are doing exceptionally well, either that same treatment or maybe in the afternoon treatment when we come back, we'll do some stair training for those of you who have to practice those steps to get into the house, okay? And then we obviously are gonna have that brief discussion of car transfers and how to do that, okay? For most patients, by the time that they reach mid-afternoon or late afternoon of the first day post-operatively, you're gonna be going home. So we want you to prepare yourself for that. Most insurances nowadays are not gonna let you hang out for 3 or 4 days in the hospital. So that is a change. So we want you to be thinking about that in advance, okay? Now, for those of you who maybe don't have good home support, or maybe just are struggling a little bit more with movement, you're gonna be staying an extra night, okay? So day 2 post-operatively, okay, we wanna start to increase that independence, okay? So we're gonna be there morning and afternoon again. We're gonna be going through your bed exercise. We're gonna be trying to improve your independence with walking, get you moving better with transfers, using the walker, okay? And we're gonna recommend that every 2 to 4 hours. So we don't want things just, like I said, getting too tight and too stiff. You're gonna find post-operatively that within probably 30 to 45 minutes of either sitting or laying, that those joints are gonna get stiff and your body's gonna want movement. And so it helps to do that. Again, icing regularly. We usually recommend 15 to 30 minutes, probably 4 to 6 times a day. And that can be done with most of the total joint surgeries, okay? Going over your stair training if we need to do that, and we haven't done that on the first day post-op. And then talking about car transfers, okay? Then we discuss, for those of you who are gonna be going home, we talk about home transfers. For those of you who may be going to a rehab facility, we'll kind of review some of that too, because that typically is 1 to 2 weeks, maybe a little bit more, just depending on, like we said, about support and how other things are moving, okay? So, with the total hip surgery, there might be some precautions that your surgeon is gonna have you follow for several weeks, okay? With hips, those precautions vary upon the type of approach that the surgeon takes as he goes into surgery. So, if you have what's called an anterior hip, meaning he's gonna go in from the front or even the side just a little bit, there's actually relatively few precautions. If, however, you have a posterior approach, which is more kind of on the back side, there's a couple of things that we want you to avoid. One of them is we don't want you crossing your legs, okay? We don't want your knee coming higher than your hip, no matter what position you're in. And then we want to try and avoid turning your foot in too much for the first 6 to 8 weeks. So we want to keep our feet fairly neutral, okay? Now, regardless of whether you have an anterior approach or a posterior approach, you're still going to have similar healing times, okay? It's still going to be anywhere from 6 to 10 weeks for that tissue to heal up. So it doesn't matter which approach the surgeon takes. The surgeons are good at what they do. They've had a lot of experience, and so you're in good hands. So don't let that be a worry to you, okay? The other thing that we don't recommend is laying on that surgical side for probably about 3 to 5 or 4 to 6 weeks. It will not feel good. It's gonna hurt. So if you were used to sleeping on that side, try and maybe start to change some of those habits now, whether that's on your back or partially on your other side. We recommend starting to get in some of those habits because that will get your body used to that, okay? Now, what we expect from you to go home is we want to make you as independent and safe with your transfers, getting in and out of bed, in and out of chairs, as we can make you, so that we don't have to worry about your safety, okay? Walking with your walker, probably our goal is anywhere from 100 to 150 feet round trip. The reason that we have set that distance on a goal is because we have found repeatedly that patients who are able to do those distances can get safely from their car all the way into the house, and we don't have to worry about you wiping out energy-wise before you get there. We want to make sure you're able to do that, okay? We want to make sure that you're able to go up and down at least 3 or 4 steps, and you have the mechanics of that down for those of you who need to do that, okay? We want to make sure that you're doing the exercises, okay? It is really important. Some people think that, oh, you know, I'll just do the exercises when therapy works with me. Well, we're only going to be working with you once you leave the hospital, probably a couple days a week. So it's up to you the rest of that time. We usually recommend twice a day going through the exercises to try and build those muscles up and make sure that you're healing and improving your strength, okay? Getting up for all your meals. So again, I'm going to repeat that mantra. Don't eat in bed, okay? We want you getting up, eating, sitting as you eat, because you breathe, you digest, things go a little bit better that way. Now, patients frequently ask me, can I hurt the hardware? Okay, is it fragile? No, you cannot hurt the hardware, okay? The hardware is designed very durable, and about 20 minutes after whichever surgeon works with you, about 20 minutes after they put that into place, it's as solid as it's gonna be. It's not gonna move, okay? What hurts and what makes you think about hurting is just because he's had to make some cuts on your bone to get that hardware into place. That's what creates a lot of your pain, okay? You're not gonna hurt the hardware by walking or by going up or down steps, okay? It's pretty solid. Now, another frequent question we get is, can I heat that area? Well, for the first 2 weeks, we recommend trying to avoid introducing additional heat to that area. The reason being is because your body has a lot of post-surgical inflammation, and we want to let the body do what it needs to do for the first couple of weeks and just let that tissue start to calm down. If it can calm down, you're going to do a lot better. And then once we get 2 to 3 weeks out, then yes, if we want to introduce a little heat, but briefly for short time frames, we can do it at that point. Now, icing, yes, we definitely recommend it. And like I said, 4 to 6 times a day, 15 to 30 minutes at a time, okay? What you find that's different with the total hip versus a total knee is your total hip will swell around the hip, and it may swell all the way down your leg. And so you may be moving that ice pack around at different points depending on how your body's reacting, okay? You'll typically be getting a gel ice pack here post-surgically from the hospital. You'll take that home, you just freeze that for a few hours, it's good to go, okay? We also have an ice bag recipe that is on the exercise sheets that we'll be giving you as you leave the hospital. You mix rubbing alcohol and water together, it costs you like $1, okay? Pretty simple to work with. Patients also ask, can I use frozen peas, corn, things like that? Yes, you can do that, okay? Now, at home, looking at this slide, okay, we don't want you going home and just doing this, okay? We don't want you just laying and thinking, oh, it's gonna magically get better, okay? So, you're gonna need the ice, and you need to do your home exercises, okay? We want you walking regularly. I'm talking 3 to 5 times a day, and that's separate from meals, separate from bathroom trips, okay? But not unlimited. So we don't want you resuming regular activity within the first week, okay? So don't plan to go home and start mowing the lawn or doing other chores like that. You're gonna be sore, you're gonna be tired, okay? So plan for other people to take care of those activities for you, okay? What we tell people is, remember, the doctor's done his work, he's done his surgery, now it's time for you to do yours. And typically what I tell patients is, if you'll do your work really well, you'll do your home exercises, you'll do therapy for about 6 to 8 weeks, you're gonna be happy with your new total hip for years to come, okay? So the other thing is, remember your precautions. Whether that's an anterior or posterior approach, we'll go over those things with you again in the hospital, but remembering as you're getting in and out of bed, in and out of chairs, you want to follow those precautions for about 4 to 6 weeks until that connective tissue gets healed up enough so that we don't have to worry about that, okay? Now, the other thing that we recommend for both hip and knee patients is elevation, okay? The way that we recommend you doing that is in this picture, if you're looking at it. We try and prop pillows from about mid-calf on down, so you're laying on your back, you get that leg up at or above heart level, okay? It's important to do that. We don't want anything behind the knee, okay? Patients will frequently tell us, oh, you know, it feels so much better if it's up behind my knee. It does, but what will happen is if you lay like that repeatedly, and that includes sleeping or naps, whatever, your hamstrings back here are going to start to get tight, and what that will do is that will shorten your step length and it'll make you limp, okay? So we don't want to be doing that, okay? So that's why we recommend about mid-calf on down, okay? Try and get it at or above heart level. And what that does is that just dumps that fluid back towards your heart, and then your heart can get rid of it and get it out of your system, okay? Typically, the better controlled your swelling is, the better your motion is, and the better your strength is, and the better you're gonna move, okay? So we recommend doing this 2 to 3 times a day, probably 20 to 30 minutes. So between the exercise, between walking, between icing, your days are gonna go by pretty quick, okay? And as I talked about, your hip sometimes will swell all the way down the leg a little differently. So kind of keep on that. The other thing that we sometimes will recommend with patients is having just a basic over-the-counter compression stocking for the lower leg to sometimes help with the swelling. It's not mandatory, but sometimes that does help, okay? Post-op rehab, okay, that's another question we get, okay? Do I need additional therapy? Well, if you ask a physical therapist if you need additional therapy, what's he gonna tell you? Yes, okay? We're a little biased because we're PTs, but the research also is showing us that patients who do get at least a little formal therapy really do better than patients who just go home and they just get a home exercise program or a handout given to you. So, like I said, we're just in the hospital, we're just going over those basic foundational exercises, and then we start to build on that. The most common mistake we're seeing patients make nowadays after receiving these surgeries is they go to Dr. Google or Dr. YouTube and they start to look up exercise, okay? Dr. Google and Dr. YouTube do not know you, okay? They have not been trained in physical therapy treatments, okay? They don't know physiology and tissue and what's going on, okay? We want to build on things. We want to do things when it's appropriate for your body to tolerate those movements and positions. So we do that over time. We don't do calculus before we've done basic math, okay? Now, people ask, okay, what does outpatient therapy give me if I'm going to go? Well, we do know for a fact that it gives you quicker gains in motion, strength, okay? We have a very individualized program. So even though we're going to do similar exercises with patients, irregardless of whether they've had a hip, knee, shoulder, I'm still going to be adapting those exercises to you because your body at 3 or 5 weeks is going to be ready for certain exercises where Mrs. Jones might not be ready for those exercises. And so we have to adapt that to you and what your body's ready for, okay? A better understanding of what is okay, if it's too soon, if we're a little behind, if we need to pick up the pace a little bit, we're going to be guiding you along. We know what the time frames are, and we have seen hundreds of knees or hips on a yearly basis. My group has seen thousands of these surgeries over the years. So we want to make sure that you get good results, okay? We can usually give you guidelines about weaning off your pain meds. Most patients nowadays are worried about, oh, am I going to get addicted in the first 2 weeks? I tell you no. If you need pain meds in the first 2 weeks, take them, okay? Because it's going to help get you through. This is major surgery. This is not like getting your wrist scoped, okay? A knowledge of your physiology, your healing processes, rehab processes. So we're looking at all of this. We're putting together your motion, your strength, your transfers, how your tissue's looking, putting that all together. And if we see something that just doesn't add up or things that are out of line, we have a very good rapport and relationship with your surgeon. And we're going to be contacting them and saying, hey, something's off with Mrs. Jones. Do you want to see her in your office? And we can do that. Frequently, we will text them back and forth. We'll just walk in and talk to them. And they'll say, no, she's okay, or yes, I want to see her immediately. So put your mind at ease as far as that relationship goes, okay? Quicker return to function is really what we're trying to give you. Yes, you can go home and you could treat yourself, but in most cases, you're going to be 3 to 5 months getting your motion, your strength, your balance back. We can do it in about anywhere from 4 to 8 weeks, okay? We can give it to you faster and in a better controlled fashion. Next question we frequently get is, how long does physical therapy last? Well, it really is function dependent, not time dependent, okay? So hips, typically we find anywhere in the gamut of about 4 to 8 weeks, okay? How long should I use my walker, your cane, your crutches? Well, again, we're gonna say it depends, and that's not a perfect answer because each of us is gonna rehab differently. Each of us is gonna regain our motion, our strength, our balance differently. And so we're looking, again, at certain markers, the way that you're moving, the way that you're walking, the way that you're transferring. So if we don't think it's safe to transfer from walker to cane to nothing, we're going to say, hey, why don't you hold back a few days and give your body a little bit more time. Again, what we want you to do is what's most safe for you. We definitely do not want you falling with this surgery, okay? Don't get rid of your devices too early, because sometimes I'll have patients do that and they'll walk in and seeing me and they're doing this kind of a thing and limping along. That's not great because it's going to wear your muscles out too early, and then you're going to end up even more sore than you are. So kind of follow our guidelines if you can, okay? How far should you walk? Well, listen to your surgical side, and I say that meaning your body's going to tell you when it starts to get tired or it's going to become painful, okay? When it does, take a break, okay? Call that your halfway point, or call that, okay, I need to stop for 4 or 5 minutes and just rest. And then maybe you can go a little bit more, okay? We recommend increasing your distance walking about every 2 to 4, 3 to 5 days, just incrementally bumping that up. And that's not like blocks more walking. That might just be another 100 feet. That might be another minute or two. It's going to be dependent on how you as a person are feeling, okay? Now, stairs, going up and down steps, we usually are going to chant the mantra with you, up with the good, down with the bad, for the first 3 or 4 weeks, okay? We suggest, for those of you who have like man caves or other things, sewing rooms you need to go into, if those are down in the basement, try and stay on the main floor and try and have other people do those things, especially if it's 12 to 14 steps, because you're going to be, like I said, you're going to be sore, you're going to be weaker. So yes, you're going to have to go up those few steps to get in and out of the house, but aside from that, try and stay on a main level for a little bit, okay? So, lastly, driving, okay? So, if you're on narcotic pain meds, we usually tell you hold off for a few weeks, okay? Let your body start to get those out of your system. We want you clear thinking as you're driving, okay? With your left leg and with an automatic car, probably within the first 2 to 3 weeks, you'd probably be okay doing that, okay? With your right leg, with a total hip, it's a little different animal, okay? What we're looking for is we want good motion and we want good reaction time. So going from gas to brake pedal. We want you to do that safely and quickly, okay? Definitely don't want things compromised as you're driving. Now, in the end, it's all about balance. And you're like, balance? What do you mean? Well, our society typically has this phrase of, you know, if a little's good, more is better. Well, that's not necessarily true with total joint surgeries, okay? So we try and adapt that a little bit. What we're going to tell you is you need some exercise, some walking, some ice, and then the rest is rest, okay? Your body needs time to heal from this. It's gonna take time. You're not just gonna bounce back in 1 or 2 weeks to everything that you're doing. You're gonna get frustrated, but be patient with yourself, okay? Down the road, okay, patients say, okay, when can I put on shoes or socks, okay? Hips, if it's posterior approach, it's gonna be about 6 to 8 weeks, okay? It's gonna be a little longer, okay? Kneeling with your hips, probably within the first couple of months, okay? Walking longer distances, usually 2 to 3 months, you'll be back to community distances, like walking through Costco or Walmart or other areas like that, okay? Outdoor activities like gardening, hiking, golf, usually within about 3 to 5 months, you can start to resume those activities. But again, it's understanding your body and understanding your limits. Yes, you're gonna push yourself a little bit, but don't go overboard, okay? Really appreciated your time listening to this. We are excited and we will see you soon.